not use CMS or marketplace logos without explicit approval. I should say if you purchase leads, you are also to ensure that you are purchasing compliant leads, for the reason being that you would still could be responsible for those. ACA agents must recertify annually to assist during open enrollment. So as mentioned before, whether it's the FFM, the Federally Facilitated Marketplace certification, or the individual state-based marketplace, make sure that you're doing those annually. Record keeping. You are to retain enrollment and client interaction records for at least 10 years. With that being said, you must be available for audits or inquiries from CMS or state regulators at any time. So keep your records clean. Most importantly, store all communications and any communications when it relates to plans, consent, changing a plan, anything. Store that information, document it, and save it for at least 10 years. Not that it's super common if you're an ethical agent doing what you should be doing, storing everything. But sometimes people make a claim or they come at a carrier and say, "Oh, I never spoke to this person," and sure enough, you did. You have all of it documented. If you have that proof, send it to the carrier. Gets cleaned up pretty quick, pretty easy if you cover all your bases. Now, maybe you did talk to them, but you didn't store all that information. You now have nothing to protect yourself, even if you did do everything ethically and correct. You just didn't store and keep your interactions. That unfortunately can come back to bite you. So, biggest thing here, store that data, keep it organized, and definitely make sure you keep it for 10 years. Penalties for noncompliance. Some consequences, not all, include the loss of your CMS certification, revoking of your state insurance license, and your carrier contract being terminated. Now, a few things here. If those things happen, that means you could lose not only access to certain carriers, but you could lose your entire insurance license and all the commissions that follow. So, if anything, just make sure that you're doing things ethically and correctly. Most important thing I can say. Proper use of your NPN number. The national producer number is mandatory for client application submissions, commission attribution, and compliance verification. Best practices, always verify your NPN is accurate, maintain current licensing and NPN info across platforms, and use your own NPN. Don't share it, don't substitute it. Make sure you're using your own NPN. NPN override. This is from the state of Florida. They're not the only state that does not allow NPN overrides. So be sure you are paying attention to what states you mark in, and I should add what carriers you're using. Ambetter, United Healthcare, they don't do NPN override. Not just Florida, there are other states that you cannot do NPN override. So be sure you recognize what states, what carriers. Biggest thing here, I would say, if you can, and you are in states that do allow NPN overrides, I would maybe, again, this is from David, this is not from Benavest or CMS. I would maybe get in the practice of just having your agents write in their NPN and you write in your NPN for the sake of if other states continue to follow suit, it's the easiest and cleanest way. So just be sure that you understand what states do allow it. If you are doing NPN override usage with downline agents, that's okay as long as you're doing it in compliant states and carriers. But there could be others to follow, is all I'm saying. Carrier coaching process. So if a carrier does reach out to you, the carrier will contact you directly, the agent, not Benavest. They will contact you. Most carriers will make 2 to 3 attempts before contacting us here at Benavest. At that point, we do our best to get in touch with the agent, with you. so that information can be provided to the carrier. The thing we cannot stress enough in this regard is you, as the agent, are responsible for your client interactions and your carrier coaching processes. Carriers will reach out to Benavest because we are obviously the FMO, but that still stands. All we're going to do is try to get a hold of you. Biggest thing I want to note here is make sure that your contact information is up to date in all carrier portals, every contract you have, every state license you have, whatever the case is. Make sure that you have everything up to date. If you recently moved, changed your email, changed your phone number, whatever the case, we don't think agents are purposefully dodging carriers, because if you do, then you're just going to, lose your contract with them anyway and have more issues down the road. But a lot of times it's because the carrier is sending an email to an inactive email address. So it's your obligation and responsibility to make sure all carrier portal information is up to date and that you do receive those communications and you comply quickly. So be sure that you check that today. I would suggest, or this week. Go through your United Healthcare, your Ambed, or all your different carrier portals to make sure the information is up to date. So if they do need to get a hold of you, they can. Consumer consent requirements. Obtain document consent before assisting with or facilitating enrollment in an Affordable Care Act plan. Applications for advanced premium tax credits or cost sharing reductions. Consumer consent must be obtained prior to any enrollment activity. Before. Consent requirements must be reestablished whenever changes are made to eligibility information, plan selection, and enrollment status. This information is coming directly from carriers.